Hi everyone, welcome to my channel. For anyone who is new here, I am Harini and I just gave birth to two beautiful boys, twins, 3 and something weeks ago. And a lot of people had asked me a bunch of questions that I wanted to, well, I have been trying to answer them as much as I can, but I just thought that if it does help anyone who's looking for more information on other people's pregnancy journey, well, here is mine. So I do have this big folder. This is everything pregnancy related of mine. I'll just start off with when we found out and things like that. So we found out we were pregnant at 4 weeks. We had been trying for a very long time. More on that on a different video, but we could not believe that that was the case because we had been trying for about 5 years. So we decided that we wanted to get as many tests done as we could. So we did 2 pee on a stick, which I did by myself without my partner. Then I surprised him, which is also a video there. But I did 2 tests, and then with him I did another 2 tests, and that test was another positive, negative, and the 4th one was pregnant or not pregnant, and then the other one was how far along we are. So after all those tests, the 6th test was a blood test at the GP. They wanted us to get our ultrasound done, which is apparently normal at between 6 to 7 weeks, I believe. So we were supposed to go and get an ultrasound done, but they had mentioned, the GP did mention that we should do an ultrasound, an internal ultrasound as well. I thought it was normal. So going into the scan, we went for a normal scan, and then the guy said, oh, hang on, we might have to do an internal. My heart dropped. I thought there's no heartbeat again, because you don't actually know what you're looking at. Like, you're looking at the screen, you're trying to find something that you can see, like maybe like a little thing, but you don't actually know what you're looking for unless you have done like tons of research and like you have seen these videos. I just, I didn't. So I'm looking at the screen. He says we might have to do an internal. My heart drops. I'm like thinking to myself, there's no heartbeat, and I'm like, oh, is it for a better viv? And he was like, yeah, because I see 2 heartbeats. And I was like, no. So it was just like all in my head. But me and my partner, we were both like, we went in thinking to ourselves, let's just not get too excited. Yeah, so 7th week we found out that we were having twins. The guy who did our scan, he mentioned to us they seemed like mono twins, which we had no idea what it meant. And the guy was like, I'm not too sure either, but you can just go and ask your GP and get more information. And I was like, okay. As soon as we came out of it, we were so happy. We were jumping up and down in the car park actually. And then once we got in the car, we called our parents, we told everyone, everyone who was close to us, we told them. And yeah, we were driving home, and as we were driving home, of course, I went on Google and I just typed in mono twins, and all this information that, like, I shouldn't have researched came up. And so I researched about mono twins, and it gave me all these, like, horrible facts that could go wrong. And being the person that I am, I'm like, okay, this is what's gonna happen. But long story short, at 13 weeks we did another ultrasound and we found out they were mono twins. So let me just, actually I do have the details of what mono, and no, I don't think I have mono, but where is this? Okay, so we were told we were having mono twins, which means they are sharing the same placenta and same amniotic sac, which comes with more risks, much more risk than what we later found out that we had monodi twins, which means so short form they call it MCDA twins. This means that your twins are sharing a single placenta rather than having one placenta each. However, your twins are in separate sacs, amniotic sacs, which means their umbilical cords cannot get tangled. That was one of the major risks that came with mono twins. So basically, again, this is like, you know, things that could happen. So things that could happen with a mono pregnancy is that the umbilical cords can get tangled up in each other's like limbs and cut off the blood circulation. It could not happen as well. So if you are having mono twins, honestly, just go with the flow. Ask your GP. They are taking the most like, I do believe that they're taking more precautions with the mono twins, and they do regular checkups and things like that. So really don't stress yourself out about something that could or could not happen. For us, we found out later that we had monodi twins, and you know, again, it came with their own risks. So with our sets of twins, monodi twins, what are the most common complications of a shared placenta? Selective growth restrictions. In a selective growth restriction, one baby grows well, but the other is very small. This is due to an unequal sharing of placenta. Often one of the twins has its cord going into the edge of the placenta, which is, I'll actually show you. This is all information that I got from my hospital. Again, my hospital, hashtag Mercy Hospital, most amazing hospital that I could have gone to. But if you can see, let me just, yeah. Okay, so if you can see, if they are sharing the placenta on each side and it's equal 50-50, that's great. But sometimes what happens is one of the babies is attached to the edge over here, while so getting 20% of the placenta, while the other gets 80% of the placenta, and that can not that it's like, you know, the end of the world or anything, but that just means it has more nutrients and gets more of, like, you know, what they need, while the other is getting the leftovers. The second complication, twin-to-twin transfusion syndrome. So these are all information that I got from my hospital. I'm not sure how that works with other hospitals, but I just got all these bunch of, like, you know, things that I might need. So like things to just read through, which is great, because like when you go on like online and you research these things, you all get like the worst outcomes and things like that. So this is pretty much like just a general information of things I need to know. So what might I notice with my twin pregnancy? You may have more noticeable symptoms of pregnancy. For me, it wasn't the case. Like, I didn't have any symptoms until my 7th week of being pregnant, and even that, it wasn't crazy like where I had to throw up every 5 minutes and things like that. No. So they do say that it might be more. My belly didn't pop until, I would say, about past 3 months. That was pretty good. You may need to stop work earlier, which I did. I did stop work in December. No, October, November, December. Yeah, roughly about 3 months in. So my fourth month. Then if you were carrying one baby, depending on how you're feeling during your pregnancy. I could have honestly worked like longer, but my partner was so paranoid that he wanted me to, like, you know, just stay home and rest. But didn't complain. What does a twin pregnancy mean for my health? Most women carrying twins have an uncomplicated pregnancy, but have a higher chance of some problems, including high blood pressure, preeclampsia, gestational diabetes, getting induced for labor, or cesarean birth. bleeding after the babies are born. I had none of these, but I had a whole different one, which I'll get into. What are the potential risks for my babies? Twins are much more likely to be born early than single babies. This may be due to body going into labor on its own, or because we recommend having the babies earlier due to complications. The risk of health problems for the babies depends on how early the babies are born. Your team will discuss your individual situation with you if early birth looks likely. Twins are also more likely to have slower growth, as one placenta might not be able to feed both of them properly, a higher chance of some problems such as heart disease. Detailed ultrasound to check your twins will be done at 12 to 13 weeks and again at 20 weeks. That was not the case for me. So after my 13-week ultrasound, I had an ultrasound every second week. So 13 weeks, and then I went to the hospital, and the hospital took care of me after that. So I think it was from week 18 I had ultrasound all the way up to 28 every second week, and then from 28 I had it every week. How often will I have ultrasounds during the pregnancy? When you are 16 weeks, we recommend getting ultrasound every 2 weeks. There you go. It was at 16 weeks actually. How and when will I give birth to my twins? The safest time to deliver MCDA twins is around 36 to 37 weeks, about 4 weeks before your babies were due. Vaginal birth is safe if you and the babies are well and the first twin is head first. However, we may recommend a caesarean if it is a safer, if it will be safer than attempting a vaginal birth. I was given the option of having a vaginal birth, and it was like basically described to me as like both my babies were growing in the same percentile, so there was no issue with like the babies being bigger or smaller, and the other thing was because like the reason that they said that you might have to go for cesarean is if the first baby coming out was bigger than the smaller than the second one, then the second one would have to be cesarean. And the other thing was if they flipped. So it says here that if both twins are head first, it would have been fine, and which was the case. So both my twins were head down. It was no issue. But I chose to go for a cesarean because I just felt safer with a cesarean. I was diagnosed with cholestasis at 27 weeks. I was diagnosed with cholestasis, which means bile acids were being released into my bloodstream, and that could have resulted in a stillbirth if the babies were like in that environment for too long. So I was recommended to have blood tests done regularly, and the first blood test that we did, it was so high that they said that I have to deliver my babies at 32 weeks. We did another blood test the next week, and surprisingly the blood, the bile acids in my blood just completely dropped back to normal. And then we pushed it again to 38 weeks, and then we did another blood test the next week, and it was coming up again. It was just up and down, up and down. So we went from 32 weeks to 38 weeks to 36 weeks to 36 weeks and 5 days, and then I got a call 35 weeks something, and I was given the option of having the babies earlier, which was like 5 days earlier. So 5 days earlier than the actual date I was given to have the babies, because like basically Dr. Willem said, why wait when you can have the babies at 36 weeks on the dot, and that's what we did. So complications with the cholestasis, it was honestly worse than the whole experience of childbirth, like the cesarean, the recovery, everything, the cholestasis symptoms were the worst. It was heart pains, like, no, sorry, not heart pains, chest pains, which made me think that I was having a heart attack because my family does have heart diseases. So I thought that was my, like, cue, I'm having a stroke. But it turns out it was just like the food not being able to be broken down, and like it's pushing up again or something like that. And it was just like honestly the worst kind of pain that you could imagine. Like I don't even want to know what a heart attack feels like, because if this is this bad and a heart attack is worse, I would just die there. Yeah, so I still have complications with that. So after having the babies, they said the cholestasis would sort of just like, go away. But I did have to keep regular appointments and checkups with my GP, which again, I probably didn't do as much as I should have. And it still comes and goes from time to time. And that is because now that I found out it's gallbladder stones. So I am on the waiting list to get that operated now. There's something that you didn't know. Yeah, so that's just the childbirth experience for me. My surgery and everything went great. So I didn't feel a thing. The recovery was great. After the bubs came home, they were great too. There was just a small hiccup with one of the twins had to stay back for an extra week. That was hard again, but we pushed through it. And here we are. So I don't know. I hope I answered a few questions of yours, but